and welcome all of us to day 2 of the summit.
Your Excellency, the Deputy President of the Republic of Kenya, Professor Abraham Kithure Kindiki, Your Excellency, the Chair of the Council of Governors, the Vice Chair, the Chair of Health, and the many other governors, WHO Country Rep, Dr. Nema, colleagues from MOH, and colleagues from our county governments who work within the healthcare system, the chairs and members of the Health Committee of both Houses of Parliament, partners, donors, ladies and gentlemen, good afternoon. Your Excellency, my work is very simple. This session is bringing together 3 elements that make a very important contribution to the whole of the healthcare system. And they truly perform in such a way that if they are not working, then the healthcare system is not working. And these are healthcare service delivery. What goes on in our hospitals and health facilities, the healthcare workforce, and Your Excellency, when I came to the Ministry of Health, the first day, you and the President gave me that task. I was not welcomed to the Ministry of Health. There was no red carpet. I found the gate closed by demonstrating healthcare workers. And on a light touch, I asked P.S. Mudhoni, because P.S. Oluga by then was not there. I asked P.S. Mudhoni, fine, I will come in, but how do I go home after my duty? And she told me, no, you can pass through Kilimo House. There's an exit. And I told her, I am not going to pass through Kilimo House. My official gate is the gate of MOH. So the first day I started addressing healthcare workers, demonstrating. They baptized me, but I was very happy last night. At least both me and the Council of Governors, one thing they have agreed is that the last 2 years, we have resolved as a government all the industrial disputes working with the counties, from the posting of internship to the CBA agreements to UHC. So healthcare workforce is another thing that we are going to have and discuss in this session. The third one, which is important, is health product and technologies. We must discuss and we must get a solution to the historical issue in our country that hakuna madawa katika mahospitali na zahanati yetu. So, Your Excellency, service delivery is where reforms reaches the mwananchi through a very dependable primary health care, emergency response, surgery, mental and newborn and oncology and specialized care. The health workforce provides the knowledge, the skill, the compassion required to deliver that care, while the health product and technologies ensure that health workers have the medicine, they have the diagnostics, they have the equipment, and the supplies they require. Your Excellency, these 3 elements are inseparable. A trained healthcare worker without medicine or a functioning equipment cannot provide quality care. Commodities and technology without competent personnel cannot also save lives. An investment in either of these is meaningful only when the result is in an accessible, safe, and timely service for the patient. The effective integration of all these is therefore very central and timely for one important person, which is the patient. The effective integration is therefore central to improving our healthcare outcomes. It will be protecting families from financial hardship And above all, it will strengthen our public confidence in our healthcare system. Your Excellency, as you have remained central to the coordination of government delivery agenda, and if I'm given an opportunity, I can speak for the Deputy President. I have seen many Deputy Presidents. I have seen many Vice Presidents before the enactment of the new Constitution. I have worked with the Deputy President in the legislature. He was the leader of majority of the Senate. I was the leader of majority of the National Assembly. We worked with him in the security sector. He was the Minister for Interior, and I was the Minister for Defense. So the person sitting before us, just in one word, not his position, not where he comes from, not his county. Kenya has a very decent in terms of personality in the name of Professor Kindiki. And that's why those of us who work with him in cabinet, that's why today I expect him not only to talk about these three themes, but of late, he is the one who does the summary of government achievement and programs the last 4 years. So as he gives us the highlight of this keynote address before we go to the panel, Your Excellency, as you used to do, I want you to start your summary from yesterday's plenary of the President. And you end it with what you have for us today. As we go now, later, with His Excellency, the listening session. So you have the opportunity to do that, Your Excellency. And now it's my distinct honor and privilege, colleagues and delegates, to stand up as we welcome His Excellency Professor Kindiki, the Deputy President of the Republic of Kenya, to deliver his keynote address.
Tafadhali na